So you completed your EMT basic through your local college or university. You signed up for your National Registry test, and now you want to know what you can expect on your National Registry cognitive exam. I'm going to break down the 5 different content areas that you can expect on the National Registry test and what percentage they make up of your overall test score. Stay tuned. All right, before we get started, as always, if you are a longtime subscriber, thank you so much for subscribing. But if you haven't subscribed yet, be sure to hit that button down below, and also be sure to hit that notification bell to be notified when I post videos similar to this one. Quick disclaimer, guys, the information that you're about to see in this video is as of October of 2019. If you're watching this in later years, it may have changed, but it is current as of right now, and you can always check it out on NREMT.org. As I've stated in my previous videos, the cognitive exam is a computer adaptive exam, and you can expect between 70 and 120 questions total on this exam. And unfortunately, I'm not going to break down the way that they grade the exam because frankly, I don't know, and it sounds like a super complicated process, but I will go over the different content areas so that you guys know more or less what to expect and how big of a percentage they are of the overall test. Okay, a couple of things before we get into the different content areas. 85% of the National Registry questions on this exam are going to be directed towards geriatrics and adults. And then the remaining 15% is going to be geared towards your pediatrics. So even though pediatrics only makes up a small percentage, it's still very important that you study up, you know your peds dosages, you know how to take care of pediatrics and things of that nature, because just like out in the field, we don't see a lot of pediatric stuff, but when we do, we need to know our stuff. All right, your first area is going to be airway ventilations, respirations. This can be as basic as knowing your normal adult respiratory rate, all the way to something a little more complex like your gas exchanges that you can expect with respirations. My best advice is just to study up and know as much and retain as much as you possibly can in that section of your book. Next is cardiology. This is gonna make up between 20 and 24% of the total test. So this focuses obviously on cardiology, the anatomy of the heart, and resuscitation. All right, next comes trauma. So trauma makes up between 14 and 18% of your total test. This is a smaller percentage of the overall test, but as EMS professionals, we do see traumatic injuries and we must know how to treat them accordingly. Next area to cover is gonna be your medical section. Now this is the biggest section on the test. It's very broad because it contains obstetrics, gynecology, pediatric stuff. It covers between 27 and 31% of the total test score. So my advice on this specific section is to know your signs and symptoms and your keywords for certain medical conditions, because that will help you tremendously. Lastly is going to be your EMS Operations Section. So this is probably the most underestimated section. It's the smallest section. It makes up between 10 and 14% of your overall test score, but it has less to do with the medical side of EMS and more to do with the operations. So many people, especially firefighters who maybe deal with the operations a lot more than EMS, they tend to overlook it, and I would advise against that because I have known of many people that have failed the entire exam because of this specific little section. So study up on your EMS ops. Just be aware that failure of any one of the sections that I just listed to you will result in failure of the entire exam. So don't underestimate or focus on just one section. When you're studying, you need to make sure you're focusing on all of them, because failure of one results in failure of it all. All right, y'all, I hope this helped, and I hope this made it a little more clear of what to expect on this test. If you're struggling with a certain portion, maybe you're nervous about it because you've never taken the test, or maybe you've taken the test and you've come up short in this section, comment down below what it is. Let's help each other out. If you're interested in learning my top tips and tricks for passing the National Registry test, be sure to tune in next week because I'm gonna go over all the tips and tricks that I implemented and I witnessed my coworkers and friends implementing that ensured our success on the National Registry. Good luck to all of you preparing to take the National Registry test. I am not going to lie to you, it's not an easy test and not everyone can pass it, but I have all the faith in the world in you. I know that hard work and dedication will result in success on this test. As always, guys, if you like this video, let me know by liking it below and also share it with all your fellow and aspiring EMS junkies out there. Thank you so much for watching. Bye.